IUD preparation and insertion. Preparation. Arrange all equipment for the procedure in order of requirement on a sterile surface. Reassure the woman and tell her what is happening at each stage of the procedure. Ask the woman to relax her pelvis as much as possible. Use leg supports or a wedge cushion to tilt her pelvis to the appropriate angle. Perform a vaginal examination to determine the position and size of the uterus. Then insert the speculum while asking the woman to exhale deeply while relaxing the muscles of her pelvic floor. Ensure that there is a clear view of the portio, and if necessary, cleanse this with an antiseptic gauze. Stabilize the uterus by grasping the anterior lip of the cervix with a tenaculum forceps. Ask the woman to cough at this moment to minimize discomfort from the forceps. If the uterus is in a retroflexed position, it is advisable to grasp the posterior lip of the cervix. Stretch out the cervical canal with the forceps, applying light traction. Probe the cervical canal and the uterus to determine the length and position of the uterus before opening the IUD packaging. If the probing is unsuccessful or presents any difficulties, it is advisable to refer the woman to a gynecologist. Insertion. The IUD is supplied with an insertion tube and a plunger so that it can be inserted into the uterus in a simple and convenient manner. Step 1. Prepare for use. Open the sterile IUD package. Take the nylon threads in your hands and pull them carefully so that the arms of the IUD fold together and fit inside the insertion tube. The ends of the arms are brought together just above the opening of the insertion tube. Set the underside of the blue ring according to the recorded depth of the woman's uterus. Check that the broadest side of the ring is parallel to the direction in which the arms of the IUD will unfold in the uterus. Guide the nylon threads with your hand and bring the white plunger carefully up to the IUD inside the insertion tube. The IUD is now ready for insertion. Step 2. Insertion. Maintain light traction on the uterus with the forceps. Insert the insertion tube with the white plunger carefully into the uterus. The blue ring now touches the portio. Let the forceps rest on the speculum. Hold the handle ring of the white plunger firmly with thumb and index finger and slide the insertion tube backwards as far as the mark on the plunger. The horizontal arms of the IUD will unfold. Ensure that the distance between the blue ring and the portio remains around 1.5 centimeters. Take the insertion tube with the white plunger inside and push this up until the blue ring again touches the portio. The IUD is now correctly positioned. Hold the plunger firmly and slide the insertion tube backwards until it's completely in contact with the handle ring. The IUD is now released into the uterus. Step 3. Completing the procedure. First, remove the white plunger and then the insertion tube with a light twisting movement. Trim the nylon threads to about 3 centimeters from the portio. Finally, remove the forceps and the speculum and provide the woman with a sanitary towel. From the moment the IUD is inserted, the woman is protected from pregnancy for a period of 5 years. Removal. Replacement of the IUD. The IUD can be easily removed by pulling on the nylon threads with forceps. A new IUD can immediately be inserted if required.